Hello everyone, this is my 10th video on sport diagnosis. Today I will show you another rare condition. In this video you can see female child 2.5 year old having the typical stereotypic hand movements. So child was having these typical stereotypic hand movements since last 1 year, and in history part we found that development was totally normal up to the 1 year of age. And after 1 year, regression of milestone has occurred. Also, the language was affected. Also, child is having the loss of social engagement. Poorly coordinated gait was there. Also, IQ was affected. And anthropometry parameters was totally normal up to 1 year of age. At this age, child was having the microcephaly also. So, head growth was also affected. And these characteristic hand movements, you can see these are the hand wringing movement. Child is continuously picking the clothes and also picking the bed sheet continuously. These are characteristic stereotypic hand movements. So on the basis of all these characteristic clinical findings, what will be the clinical diagnosis of this child? So the clinical diagnosis of this child on the basis of these characteristic four findings: stereotypic hand movements, loss of social engagement, impairment of the language, and developmental regression. Child is having the Rett syndrome. It is a pervasive developmental disorder. In brief about the Rett syndrome, it is due to mutation in MECP2 gene on X chromosome. It is X-linked dominant, so seen in the girls. Prevalence varies 1 in 10,000 to 1 in 22,000. These are the essential criteria for the Rett syndrome. Initially, development will be normal up to the 12 months of age, then rapidly regress. Normal prenatal and perinatal development. So, normal birth history will be there. Head circumference will be normal at birth and up to 6 to 12 months age. Then deceleration of head growth between 6 months to 4 years of age. So patient will have the microcephaly. And loss of previously acquired purposeful hand skill between 6 to 30 months of age, with subsequent development of stereotypic hand movements as you had seen in the previous slide. Hand wringing movement. Loss of social engagement, impairment of the expressive and receptive language, poorly coordinated gait or trunk movement between 2 to 4 years age, severe psychomotor and profound intellectual handicap will be there. Some supportive criteria for the Rett syndrome: they may be having the breathing dysfunction in the form of apnea or hyperventilation or breath holding spell, having the laughing, screaming spells, maybe having the EEG abnormality, bruxism, teeth grinding, bloating, indifference to pain. These are the some supportive criteria to make the clinical diagnosis of Rett syndrome. In natural history or course of the disease, Rett syndrome is having the four stages. Stage 1, deceleration stage, between 6 to 18 months of the age, when the regression of milestone occur, child will have the affected language and stereotypic hand movements. Stage 2, rapid destructive stage, between 1 to 3 years of the age. Onset of the seizures occur between stage 2. Stage 3 is the pseudo-stationary stage or the plateau phase between the 2 to 10 years of the age, and stage 4 is the late motor deterioration after the 10 years of age, when child will have the severe affected motor function. Even the decerebrate posture, all these occur during this stage. So this is in brief about the Rett syndrome. Thank you so much.